Sir, are there any kind of specific long-term precaution or prevention care a child, like a child should take care if he or she might suffer with any kind of burn injury?
Yes, definitely. Burn treatment doesn't end once the patient get discharged. So patient has got discharged, the treatment is finished. That is not the way with the burns, because usually we discharge the patient when the burn wounds are completely healed or they are partially healed.
Yes.
The treatment is only 50%. The only 50% of the job is done. Rest of the 50% should be done by the patient, or if it is a children, the parent. So there should be proper post-operative or post-discharge protocol. There should be proper rehab. There should be physiotherapy. There should be scar care. There should be proper pressure garments and silicone gel sheets should be used to avoid further bad scarring of the burn wounds. And there should be proper splintage, proper physiotherapy.
Splinting.
If proper splinting is not done, there will be formation of contractures across the joints. This is more common in children because children are not aware that they have to do the physiotherapy. Their joints slowly get contracted. If the burn wound, the burn hand, slowly the fingers will get contracted, elbows will get contracted. This is very debilitating for them. They can't hold a pen, they can't drink water by themselves. It is very crippling. So the treatment is not done once you are gone out of the hospital. It is there up to 1 year. You have to follow some strict protocols, strict physiotherapy, strict splintage, strict scar care. This all should be followed for a better and good quality of life later on.
Basically, in burn cases, you prescribe silicone gel pad and stockings, body stockings. So, could you tell our viewers why they should wear it and what are the benefits to wear in a particular time period? What are the benefits and why they should wear it?
See, burn scar, when it is formed, there is a duration of scar maturation or scar remodeling. Once the scar is formed, it will take almost 6 months to 1 year for it to remodel.
Okay.
This is the phase where you can target and you can follow some scar care tips and scar protocols so that you can make the scar a bit better. You can make the scar a bit good quality scar. So if you leave the scar like that, once the scar is there, it eventually causes hypertrophic scar. It forms keloids, it causes itching, and it causes very raised, and it doesn't look good. And repeated itching, you scratch it and there will be trauma, there will be ulceration. This goes on repeating. So if the proper silicone gel sheet is used and proper compression is used, it should be used for at least 1 year. In the first 1 year, you can remodel the scar in a better way. The pressure helps. The compression garment, which gives good amount of pressure, and the silicone gel has some hydrating properties. This causes the better remodeling of the scar, and the scars evolve betterly, and they don't form hypertrophic scar. These things, it should be done for the first 1 year, and it is very, very important. If these are not done, you have to suffer later. Yes. So this is very important in the scar treatment.
So what are the long-term problems a patient may face if it is untreated or poorly treated?
See, if untreated or poorly treated long-term, first you will be having problem with the scars. When the burns won't heal on its own, they heal by contraction. Once the contraction happens, if it is across a joint, slowly the joint gets pulled away. And the joint will stuck like this. You can't open the joint. This happens across anywhere, in the fingers, elbows, in the neck, or in the groin region, or in the knees, anywhere. So anywhere across the joint, if there is a burn wound, if proper physiotherapy or proper rehab protocol is not followed, proper splintage is not followed, they causes contracture, and it is very crippling. They can't do their own job. So then eventually they have to get, they will be roaming around the plastic surgeons. You have to get this contracture released. And again, after the release, if the proper splintage and rehab is not followed, it will get recontracture again.
Yes.
So this cycle goes on repeating. So proper treatment and physiotherapy protocol, these are very, very important in the burns.
After the surgery also, the treatment done over there.
It is not finished yet.
Yes.
So there is, again, there is a rehabilitation proper rehabilitation and physiotherapy should be followed so that you prevent the recurrence of the condition.
Yes.
So that it won't come again.
Which joints are mostly affected by joint contractures?
More common is finger joints.
Okay.
So in the fingers, if the burns has happened, patient usually leave it like that. Eventually the scar will contract, and it will pull the fingers down like this.
Yes.
Or if it is burnt here, they'll pull the fingers back. It is very crippling. And over the wrist joint or dorsum or this one and over the elbows, axilla. Once the axilla is burnt, it gets stuck like this. So then the patient can't, if there is no axilla, you can't do anything with your hand. You can't even eat or drink properly. So, and neck contracture. Neck contracture is very debilitating. It is a very big social issue. Patient even can't look up. Patient can't look into the opposite person's eyes. So the chin is completely fused. Chin is completely attached to the underlying chest wall. So these are some debilitating contractures and very common in the genital regions.
In that condition, I think after surgery, if they should go for a proper treatment, rehab treatment like splinting and exercise also, then I think that will be
that can be prevented on the primary stage itself. In the primary stage, when there is a deep burn of the neck, proper neck exercises, proper splintage, and proper regular physiotherapy, they can completely be prevented.
Okay.
If they have occurred, then definitely they should undergo surgery. And again, the same process they have to repeat after the surgical release. So they have to follow all these things, or else they can't get away with that.
Like a patient came to you with burn injury. Okay. So it was a deep burn injury nearby joints. So what's your advice that how you will keep prevention care for the joint contracture?
If there is a deep burns on the joint areas, right from the day one we start the splintage. We put the patient's hand in complete extension. If it is an elbow, we'll completely splint it and we'll immobilize it in that position. And if it is a hand, we put splints over the volar surface. We put it in safe position so that from the day one we try to prevent the contractures as much as possible we can. And after the splintage has been done, in between while removing the splintage and all these things, there is a proper physiotherapy to be done. We will continuously under the physiotherapy guidance, if the patient follows everything properly, we can prevent contracture to happen. If this all is omitted, if the physiotherapy is not done, if the splintage is not done, and the deep burn is there over the joint aspects, contracture is 100% it is going to become.